Good afternoon, everyone. This is Harriet Dichter, and I want to welcome you to our webinar on the role of strategic plans in comprehensive ECCE systems building. We're really grateful for everyone who has taken the time today to join us to be able to hear from pretty wonderful states and the work that they have been doing around strategic planning in the context of systems building. We have the next slide, please. Couple housekeeping items before we start. We are hoping to be able to see everyone who is on our webinar at some point in time. So these are instructions if you would like to be able to make sure that we can see your name and your organizational or state affiliation. Next slide, please. We also have instructions here about changing your audio if you called in on your phone, if that's something you'd like to do. In addition, Sierra Norwood is supporting us at the technical end, and she is going to put into chat her cell phone number so that if anything happens and you can't get back into the meeting or you need help, please text Sierra and she will assist you. You can also put any technical problems you're having into chat and we'll do our best to be able to help you. Thank you so much. Let's go to the next slide. I'm going to start with giving you a little bit of an overview of how we're going to proceed today. So after introducing ourselves, we're going to present a little bit of background on strategic planning and systems building. And then the bulk of our time is going to be spent listening to Oregon, Washington, and Delaware in their state presentations. We will have an opportunity for open discussion, and you will actually be able to ask questions or provide your own comments or feedback, and then we'll do wrap up. I do want to encourage people that if you do have questions as our presenters are presenting, please put them in chat. They won't be responding immediately, but we will save them all for our open discussion at the end. Let's go to the next slide, please. So for the PDG-B5 Center today, as I said, I'm Harriet Dichter and Sarita Robinson has joined me, and we will be co-hosting. I'll be doing the opening part of today's webinar, and Sarita will be doing the closing and facilitating our open discussion and the takeaways. Next slide, please. We also have wonderful presenters who have really been living this work for quite a period of time to ensure that strategic planning is not an ancillary effort in their states, but is very deeply embedded in their systems building work. David is going to speak with us from Oregon, Kelly is going to share Washington's story, and Madeline is going to talk to us about Delaware. Could I have the next slide, please? So what are our objectives today? This is what we as the planners hope that this webinar will do for you. We are hoping that it'll give you an opportunity to learn from states that are deep into habitual use of strategic plans as part of their systems building effort. And you'll hear a little bit about how they got to the point that they were able to center strategic planning, not as an afterthought, but as an ongoing activity to help them with their systems building. We're also going to talk a little bit about the PDG-B5 initiative and how it views and understands the role of strategic planning in systems building. And lastly, we're going to have some focus on equity in policy, planning, and implementation of strategic plans. We could go to the next slide, please. So what does PDG-B5 have to say to us about strategic planning? We know that there are people on this call today who are participating in the PDG-B5 initiative, but not all of our participants are part of the PDG-B5 state. So under PDG-B5, there is a requirement that states have to have a comprehensive strategic plan, and that plan must be based on a needs assessment and their performance evaluation plan. So this is seen as a core element for the kinds of systems building that PDG-B5 is supporting. Within the context of PDG-B5, there is an equitable focus in the strategic planning, requiring the states and territories to focus on populations who are furthest removed from services, most typically underserved. This means that there is an equity framework or parameter right within the PDGB-5 understanding of strategic planning and needs assessment as the base for the actions you take in building your system. Next slide, please. We also wanted to focus before we hear from our speakers, just for a moment, on why strategic planning in the context of systems building. So we do see this as an integral and foundational element of creating and sustaining an early childhood system. What does the strategic plan allow you to do? The strategic plan really allows people to think about what may seem impossible and to devise the possible ways that they're going to get to the impossible and what that big vision is. The strategic planning is a grounding element that really allows people to come together, to bring many different communities together, to develop their shared vision, and of course, really importantly, using the plan to help you have the belief and the will to make it all happen. Next slide, please. So now we're ready to hear from our states. And this again is where we're going to spend the bulk of our time today. I want to turn things over to David Mandel, who's going to kick us off with talking about Oregon's story.
Harriet, thank you for the introduction. As Harriet said, I'm David Mandel, the Chief of Policy and Research at Oregon's Early Learning Division, and, which is currently sort of an independent subdivision of the Oregon Department of Education. But in a year from now, we'll become the Department of Early Learning and Care as our own standalone agency. Next slide, please. Today, I really want to focus up. So Raise Up Oregon is the name of our early childhood strategic plan. It was adopted by our Early Learning Council in 2018 as a 5-year strategic plan. And I really want to focus today on the strategies, both in developing the plan and in sustaining and implementing the plan to really build sort of a cross-sector, multi-agency vision for prenatal to 5 and shared commitment to that work. Next slide, please. I just want to mention that Oregon is a preschool development grant state. The work to create Raise Up Oregon really began before we became a PDG state, but we were able to use Raise Up Oregon as our approved ECCE plan as part of PDG. And then when we applied for our second round preschool development grant, we were really able to align all of the sort of strategies and investments in our plan with Raise Up Oregon. We've also been developing an early learning system dashboard based on the objectives in Raise Up Oregon to evaluate the impact of our PDG initiatives. And that's really some ongoing work that we're really in the middle of right now. Next slide, please. So I just want to start a little bit with the Raise Up Oregon vision. And I actually just wanted to back up for a little bit to also sort of set the stage for, I think, the kinds of problems that we were trying to solve when we went into developing Raise Up Oregon. The Raise Up Oregon is adopted by our Early Learning Council. Our Early Learning Council was created in its current form, more or less, in 2011. And it was set up as a relatively small early learning council, really focused on community leaders, as well as including agency directors from not only Early Learning Division, but also from Oregon Health Authority, Oregon Department of Education, and Oregon Department of Human Services. The Early Learning Council was actually created before the Early Learning Division, which came into being in 2013. And what happened when the Early Learning Division was created is, while the original vision of the council, I think, had been pretty multi-sector and really thinking about needs of children and families, across the spectrum, the work of the council really ended up focusing on the early care and education sector. And one of the responsibilities that the Early Learning Council was given was also rulemaking for all of the programs administered by the Early Learning Division, including childcare licensing rules. And so that really became the focus of the council for a number of years, really almost sort of on oversight of a lot of the work of the division. And I think there was working with our council chair, Sue Miller, who's really been an important leader, and a lot of this is really her vision, was how do we get the council back to that bigger cross-sector vision. And I think part of the challenge that meant is, while we did have those other agency directors as members of the Early Learning Council, I think the council was really seen as focused on the early learning care of early care and education sector, really on the work of the Early Learning Division. So I would say at that point, when we embarked on this work really in 2017, there was not strong cross-agency buy-in for the work of the Early Learning Councils. It's not that people didn't think the work was important, but I think it was seen as other people's work, not necessarily shared work at that point. So there was a real concerted effort to change that. And what you see here in front of you is what's become referred to as the pedal, which I think has really in some sense become the symbol of Raise Up Oregon. That Raise Up Oregon is about early care and education sector, but it's also about human services, housing, K through 12, and health, and all working together with that really important intersection around the early learning system. And I'll just sort of note, because the Early Learning Council, that name is in statute, one of the challenges I think we had was even that name, the early learning system, really put the light on the focus on the early care and education sector. So I think there was a fairly substantial work to really convince folks that that the early learning system was being imagined and embodied in a way that really did encompass all of these partners. As you'll see, that housing is one of the pedals in this, and that was actually something that came out of the strategic planning effort that hearing from families, from communities, the importance of housing was so important. That quickly became one of the key pedals, and actually Oregon Department of Human Services has really just been a fabulous partner throughout this work. Next slide, please. I think there was a really strong desire to center equity throughout the development of the plan, to really identify and focus on what were the strategies and focus areas that would have the most significant impact on for historically underserved populations. And I think all of the agency partners came to the table with that as a shared commitment. So I think that was really important in that shared focus for the plan, and as a sort of a silver thread throughout the plan. Next slide, please. So again, as I was saying today, I really wanted to sort of focus on Raise Up Oregon as a multi-sector strategy, and I think there was sort of three, in terms of that multi-sector strategy, I think there was really three things that we were trying to accomplish with Raise Up Oregon. So one was to make sure that each partner agency can see itself in the plan. So I think the idea was that if this was going to be truly a cross-sector plan, if there was truly going to be a commitment of all of the partner agencies to the work in the plan, they had to be able to see themselves in that work, to see work that they were already doing, to see their priorities, but also their voice and their language in the plans. And then second of all, one of the goals was also to have each partner agency articulate its prenatal to 5 age agenda and priorities. And I would say I think this is actually probably one of the biggest accomplishments of Raise Up Oregon. So other than for the early learning division, which naturally has an early childhood focus, I would say that when we started this work, the partner agencies didn't necessarily have a prenatal to 5 agenda and priority. Not that they didn't care about young children, not that they didn't actually have important work happening in this space, but that's not necessarily the frame in which they were articulating their priorities or their strategies. And so I think just asking agencies to come to the table and articulate that ended up really being important for Oregon to be able to sort of raise up prenatal to 5 as a priority space and a priority focus area. And then I think the other piece that we tried to accomplish was for agencies to understand where their priorities and work intersect with that of other partner agencies and how we could focus on that work together. And I'll talk a little bit more about what that means and what that looks like in ahead. Next slide. So this is just a little bit of an overview and snapshot of all of the forms of engagement that went into developing Raise Up Oregon. And I think what you'll see in this chart was really an attempt to be listening and hearing directly from our community partners, like our early learning hubs, to hear directly from parents, at the same time that we were also really trying to make sure that our agency partners were seeing themselves in the plan and part of the development of the plan. So I think one of the things that we did in the developing the plan was each of the council meetings was focused on one of the sectors. And in those meetings, we would both have the agency directors presenting on their priorities to the prenatal to 5 space, but we would also be working with our community partners to make sure that not only community-based organizations, but also parents and families were also part of those council meetings, and that parents were able to share directly with the Early Learning Council their experiences. And that was also really important because I think if it was that the other agency directors were there for those conversations, because I think it would have been very different if that parent voice was being shared indirectly with the partner agencies rather than having the partner agencies there to directly hear what families were experiencing as they tried to navigate through Oregon's system. So I think that was almost always the most powerful part of those Early Learning Council sessions, and really had, I think, impact on the agency partners. But I think that wouldn't have happened if those agency partners weren't there for those conversations. Next slide. So when we got to the actual development of the plan, I think there was also, I think one of the I always go back to one of the comments made by Pat Allen, who's the director of the Oregon Health Authority, who was just, along with the other agency directors, of fabulous participants in the plan. And I remember at one of our council meetings, as we were working, closer towards the draft of the objectives and strategies, Pat made the comment that the state agencies are often rightfully faulted for not coordinating, not talking to each other about what their strategies are and their plans. And Pat said, this time we actually did a great job of doing that. How are we going to let people know that that actually is the case in this plan? And I think that was actually a direct inspiration for, I think that's something that became really important, is that what we did is really made that visible within the Raise Up Oregon plan, where in the plan, you will actually see the symbols for the other state agencies where it refers to work that's identified in their plan and part of their work. And so as you see the plan, go through the plan, you can sort of have that visual image of the partner agency's commitment to the work. One of the things that we also did is use this as an opportunity to call out our commitment to infants and toddlers and make sure that that was really clearly spelled out in the plan. So you'll see the baby emoji at the top. And as you go through the plan, you'll see that there are quite a few strategies that are really explicitly focused on the prenatal to space, and have that baby emoji there to identify that and really make clear that prenatal infants and toddlers are a core commitment of Raise Up Oregon. Next slide. So I want to talk a little bit about the implementation. So one of the first things that we did after the council adopted Raise Up Oregon was to create the Raise Up Oregon Agency Implementation Coordination Team to really meet regularly to look at our progress towards Raise Up Oregon. And this group is not the agency directors, but it's people who are high enough in the organization to have access to agency leadership, to be able to assign work, but also a little bit closer to some of the key strategies in Raise Up Oregon. Also good opportunity for just really to call out the support that we've gotten in all of this work as a member of the BUILD initiative. And the BUILD initiative has also really provided a great support for this work and also for this team. And that's also been helpful to have someone at the table who's not from one of the specific agencies helping to facilitate some of these conversations. Next slide. And can I do a time check? I think I've lost track of my time. I just want to see how I'm doing in time.
You started, David, at 1:38 and it's 1:54. So you're coming to the end of your time.
Okay, that's what I thought. So
thank you for asking.
Okay, so one of the things that the first things that the Raise Up Oregon implementation team did is we also went through the entire plan and really identified the different, for each action item in the plan, the level of commitment and where agencies had identified work that was happening. And so that was a really great way of helping us to identify opportunities for multi-sector work. As I was just looking at this slide, and thinking about some of the things that came out of this, as soon as this meeting ends, I will be joining my colleagues for a legislative hearing, my colleagues at the Oregon Department of Human Services, at a legislative hearing on $10 million in co-location of early learning in affordable housing that the legislature passed, and that really resulted from the plan. We've also been really working closely with maternal child health and leveraging some CCDF funds to develop with community-based partners, culturally responsive, safe sleep practices, communications materials and messages. So I think you can really, just looking at this, I was able to really see some of the concrete projects that actually emerged just out of having this slide. Next slide. Again, we also use this team to identify progress and work that was being done. Again, each of those colored dots represent one of the state agencies. And this is just a quick snapshot, from what's over a 47-page document on the work that had happened at the midpoint in Raise Up Oregon. And then finally, I want to make sure I have a chance for the last slide. Next slide. So it's actually already time to start working on the revision of Raise Up Oregon. So we're just starting that process. I think we did a pretty good job in the first edition in bringing all of the sectors and partner agencies to the table. And I think there's really an opportunity with this second edition, the commitment from the agency directors and that cross-agency team to really work with the partner sectors and agencies to really set that table in a new way. I think we're looking at opportunities to deepen the commitment to multi-sector and multi-agency priorities. I think one of the things that we've seen is, going back to that slide with the different dots where agencies put 1 to 4 with forest as the strong commitment. When you had a lot of agencies that put 2s and 3s, but no one put a 4, I think we recognize that those were the places where probably the least work happened in moving Raise Up Oregon forward, but places where you had a couple of agencies, even if it was 2 or 3 that had a 3 or a 4, and you could really identify a multi-sector project. I think we, as I was mentioning before, we've made some significant progress, and I think that's a place that will continue to try to deepen in the next edition of Raise Up Oregon. And with that, I will pass it to our friends directly to the north, to Kelly.
Thank you, David. And yes, thank you. That's the first slide. Thanks so much. And good morning or afternoon, everyone. I am Kelly Bohannon. I use she, her pronouns, and I'm the Director of Early Learning Programs in the Washington State Department of Children, Youth, and Families. And it's such an honor to be here with all of you today to share just a part of Washington State's early childhood system story, and specifically just some tidbits about what we've been able to learn about the value of embedding strategic planning as central to how we work together across partners and with families to make our system a living, breathing part of our communities. This work for us has been underway now for over 2 decades, and while nothing about our processes have been anywhere near perfect, they're ours. And every win, every loss, every success, mistake have paved the way for us to be all of where we're at today. And I can say with great confidence, having participated now across many roles in this work for us over the years, that having a shared statewide strategic plan as our compass, our North Star, has always been core to reaching the kind of outcomes we're all seeking for our state's youngest children and the adults in their lives. And today, I'll briefly share with you how much of this started for us in the first part of the 20th century and the early 2000s, including some key wins and lessons we learned along the way. But I'll spend most of my time with you on how the PDG B5 enabled us to leverage the successes and learnings to do the kind of transformative and actionable equity change planning and implementation we're now moving into today. Go ahead and go to the next slide, please. Thank you. So there are many people, policies, and actions that have shaped our system to date, but 3 very specific planning processes and products are undoubtedly at the roots of our system's growth and success. To the left is our state's first comprehensive cross-sector 10-year early learning plan from 2010 that took about 18 months to create with our communities, and several important things came together, sort of a tapestry, to make this plan happen back then, including our state's initial early childhood comprehensive systems plan, our ECCS plan. We had a governor and a legislature that created our cabinet level agency, Department of Early Learning, paired with a public-private partnership in Thrive by 5 Washington, now known as Start Early Washington. The Federal Head Start Act of 2007 that created early childhood advisory councils, and a state law that required the new DEL and our new council to coordinate across partners to create a cross-sector strategic plan for early learning. And that resulted in 36 strategies over a decade that truly set the groundwork for us to be able to focus in the intentional way we are today. The second document is the revised version of our state's early learning and development guidelines, which came out just after the plan, which represented a real turning point in our state for what is possible when we engage in true co-design planning with communities to create something for our children that can truly be applied to all of us across race, ability, gender, class, and beyond. And it just set a high bar for all of us to rethink how to create a system that dismantles racism and exclusion. And while we don't have time to share the details of the profound influence this planning had on our state's strategic future, it's really important to note that it shaped our understanding of what it means to move from talking about equity to walking in equity. And the last document to the right-hand side is our state's early learning racial equity theory of change. We call it our RETALK. And it represents our movement as a whole community to explicitly name how we would do this work together by naming specific learning, commitments, and action that we would take to cultivate an equity-centered movement. So much of what we developed in that retalk was and is applied to the implementation of strategies in that first 10 years and certainly continues to influence as we go into this next decade of work. Go ahead and go to the next slide. Thank you. So from the early 2000s to now, the visuals here show a picture of the 2010 plan I just described and our soon-to-be-born 2022 Early Learning Coordination Plan. This is what we've learned about what's key for us in having a centrally focused plan across sectors and with communities. And first and foremost, context is everything. So having a plan has really always helped to ground us in applying what's needed to our state and specific community context. It helps achieve clarity across system participants, both deep and wide, from where we're at and where most of all of this comes to life in communities to policymakers. Having a vision and values and set of strategies centers us. And that's really what that first plan did. And now we're moving into this sort of new space with the second one in the same way. And it surely helped us do more condition setting around clarity and roles, the kind of learning that we need to do, the growth that we want to see both in each other and across and in the work, and surely for young children and families and the other adults in children's lives. And having that sense of shared accountability is obviously really key. This last one, I think we learned so much here in the first 10 years, and now it's kind of brought us where we are today, and that's really an acknowledgement of the work we need to do to really dig deep in our shared commitment to build knowledge, skills, and real behavior change to advance equity and inclusion in our work. And so that takes us to the next slide, please. Thank you. So that takes us to just a few things that we want to share about what we learned doing this for the first time back in 2010, in that first decade with the Early Learning Plan. We learned some really salient lessons in this period of time. And first and foremost was how critical the plan and its strategies were in enabling our ability to successfully bring in federal, state, and private funding and resources to our state, and how the solidarity of the plan and that shared vision won the confidence of our state lawmakers, who joined in and they committed themselves to writing landmark policies and funding early childhood at historic levels. In this time, we really used it to build cross-system partnerships and structures around the plan. We coordinated around those strategies. We wrote shared policies and grant applications together. Everything was guided by that plan. At that time, everyone who was involved had a copy and everyone knew what their part was in it, which I think made it, in that period of time, helped us grow a lot of capacity that we now have to be able to do the transformative work we're doing today. We learned about the importance of investing early on in skilled meeting facilitation and project management, which we funded throughout implementation. Those consultants really helped us develop joint agency and community action plans, facilitated meetings, and just frankly helped us keep our work afloat and coordinated. What we realized as we got to the end of this period of time, this decade, however, is that despite our very best efforts to grow this foundation and do this work across partners and communities, to build a system centered in high quality and more access for children and families, the outcomes, particularly the outcomes for children and families of color, Indigenous communities, and other marginalized communities were not improving. And we knew we had to do something different. And so that brings us to the PDG. If we could go to the next slide, please. So as we brought that work to a close, the opportunity to PDG B5 presented itself. And this is where we really took an opportunity to think about how to change the experience. And this quote from our renewal application in 2019 really sums it up best. And it says, "Our state has made great strides in improving early learning outcomes, but historical systems continue to marginalize, exclude, or impose cultural norms on communities within our state. If we want different results, we can't keep doing the same thing. We are committed to facilitate intentional design to interrupt these patterns. And that is what we have done with the opportunity of this resource. Let's go ahead and go to the next slide and we'll dive into that. Thank you. Give me 1 second here. Thank you. So how did the PDG serve us in this way? It provided resources for us to build our capacity, again, deep and wide, to engage in early and ongoing intentional co-design with our communities to interrupt the systemic oppression we knew was at the center of preventing the kind of change in outcomes for children and families we knew could only be brought about by transformative change in how we do our work, starting with planning, starting at the very beginning. And so for us, that really began with our needs assessment and then really moved in strongly to our strategic plan and has been applied across our PDG strategies and is now sort of making its movement through all forms of different parts of our system, which is really exciting. But what this work really meant for us is that we had to build equity leadership in all of us, which means for us, we're doing ongoing learning and unlearning and developing shared language and tools to apply in our work, which I'll share in the next slide. But this visual to the right is a great example of the kind of shared knowledge we're working to build in all of us. If we don't all take responsibility for understanding the very paralyzing and fatal historical and current impacts caused by individual, interpersonal, institutional, and structural racism, we can't change the experience and outcomes that we're aiming for. And so we've done this by leveraging community partners, consultants, and other supports with helping us develop the knowledge and with the help of their great facilitation skills and building ours to help us along the way. So we're all focusing on becoming better listeners and centering our communities as experts. We're learning to share power and what that really looks like and feels like, and it is not easy. We're focusing on change at all elevations of this work, from policy to practice, and making strong commitments to continue to ground our work with communities in both qualitative and quantitative data as we imagine this new way of working together. Go ahead and go to the next slide, please. So in this next slide, while we don't have time to go deep with these, this slide really represents some of the core tools and frameworks we're building our capacity in as we've embarked on this equity-centered journey in co-design. So liberatory design, which is represented by the flower, is really an approach created by our partners with the National Equity Project, and it has just been critical to our change movement because of the profound impact it has had in helping us discover the different mindsets and actual behavior change that are needed to engage in this kind of transformative work. Impact Networks is an approach that is guiding us in thinking about how we organize in our community to implement our coordination plan in the spirit of true collaboration, power sharing, and it draws on the power of centering community voice and action. Go ahead and go to the next slide, please. So as we've engaged in this next version of strategic planning, which we call our early learning coordination plan, all of the planning, beginning with the needs assessment, has been centered in and is really guided by our communities. So state agencies and legislators and other statewide partners, they're participants. We are participants and we're invested, but the power and the process has largely been by communities, and we're all learning about what that means. And what it means for condition setting and behavior change every step of the way. But this visual provides a very high-level overview of the process in how it's played out, from knowledge and content creation to design and implementation. And the next slide provides a closer look at how it's played out in the structure of the creation of content design for the early learning coordination plan. So centered in those equity tools and strategies I mentioned earlier, our overall work has been supported by the 5 core structures you see in the green here. So these bodies serve really as facilitative and supportive and advisory to the design teams and the work groups that lead the work itself. So in the green are our steering committee, our Indian Policy Early Learning Committee, a project management team that includes specific equity facilitation, a core strategy team, and our early learning advisory council, along with our parent advisory group. But the design teams are really at the core here. That's represented by well over 100 diverse community members and families across 5 areas of the framework, which you see here on the left. And they spent days creating these draft strategies pre-pandemic and post-pandemic, which was a challenge in itself, that were vetted through deep community-led processes. And once the goals and strategies landed and were finalized, community members were then central to also helping us in the design of the user experience. So how would we make sure this plan is accessible in ways that a variety of system participants need it? And so now we've moved on from that to the process of developing recommendations for designing the mechanism for how we will coordinate the implementation of this plan over the next 5 years. Please move to the next slide. Thank you. So as we are developing recommendations, what you see here is really forefront for us. So often in dominant culture, we find ourselves caught in this cycle of focusing on what we need to fix or what's wrong. And we end up doing the same thing over and over because it's the way things have always been done, and to no avail. And for us, what we've really learned is we have to slow down and stop doing this. We need to pause, we need to breathe, we need to move with intention and pave a new way together. And we need to do this in a way that reflects forward movement to acknowledge the harm that has been done to each other historically and currently, to create conditions for healing and restore, and to create space for us in connection to imagine what we want to realize for our world now and for the future. And Robin Kelly tells us in Freedom Dreams, I love this so much, that the most powerful movements begin with an imagination of what's possible and leaning into a future that's possible. And this is how we move from a transactional way of being to building a system of people and connection that transforms. And we all know that to change outcomes, we have to change the experience. And that's really what we're staying grounded in through this in Washington. Please move to the next slide. So as we move into full implementation of the coordination plan in 2022, you can see our focus continues to build on all that we've done to date, but has a much different focus than it did in 2010. So as we've just done some updating as a result of the pandemic to some of the earlier work we did in the beginning. As I shared earlier, our steering committee is moving into recommendations for how we will do this, but really reflective of those equity commitments and staying strong and growing our muscle in that as we move through that process. We've begun really looking at strategic plans across different partners and starting to connect those to having shared strategies and looking at policy and funding priorities. But that commitment to continually build our equity capacity is really at center for us. Go ahead and move to the next slide. I know I need to keep moving us along here. And so in closing, we just wanted to share a few of the golden lessons for us on this leg of the journey to date. And some of these won't be surprising, but I think it's just important to really intentionally focus and know that co-creation takes time. This work causes some slowdown, and you have to plan accordingly for that. And we've done more adjusting of work plans and budgets than we have wanted to, but it has served us well, and we've learned a lot about that along the way. And I think, again, to no surprise, especially in this day and age, that anti-racist work can become really hard really fast. But investing in skilled equity-centered facilitation and really being intentional and doing personal follow-ups to continue to repair and restore where harm is done is exceptionally important. And then I think finally for us, just this ongoing commitment to learn together and to build shared toolboxes and shared language has been really key in these 4 things that some of what I've mentioned before have been really central for us in that process. Please go ahead and move to the next slide. Thank you. And so in closing, none of this would be possible in any of our states if we didn't continue to center everything we do in relationships and community. And so we leave you with a quote by 2 brilliant and courageous women, community activists that inspire our work every day, that represents how we believe this kind of transformative work comes to life. And that is that the world doesn't change one person at a time. It changes as networks of relationships form among people who discover they share a common cause and vision of what's possible. And we're grateful for Margaret Wheatley and Deborah Fries for their continued work and inspiration in this. And so I will leave you with that, and just want to thank you so much for your time and partnership. And now I will hand this off to Madeline to share Delaware's experience.
Thanks, Kelly, and thanks, David. I'm Madeline Byard. I'm with Rodell, which is a policy and advocacy organization, nonprofit in Delaware, and I'm also the appointed chair of our advisory council, the Delaware Early Childhood Council. So that's our governor-appointed body that cuts across our 3 agencies and is codified that a member of non-government representative is the chair and in the leadership of that. So interested to share a little bit of the history of Delaware. So unlike Kelly and David, I don't represent a state agency. And just to share this history going back to 2008, I've been involved and engaged in these plans, implementing them and developing them. This goes across 3 administrations. So 3 governors, 3 sets of relationships, Kelly, that you mentioned, people to develop shared understanding with. The strength of the relationships that Kelly mentioned stands out to me because we're not going anywhere. When the next governor comes around in 2 years, all of us allies and advocates will still be here, and we will be developing our next plan. So just want to give a little context here. The plan from 2008 was developed after the Head Start Act that Kelly mentioned as well. And our council was codified to have a charge of having a strategic plan and helping implement that. Like some of the other states today, we leveraged, PDG and our early learning challenge funding to kind of help us use those milestones as times to plan and use resources to build these plans. And we've intentionally tried to kind of build them on each other. You can see that with the titles of these here, all about early success. So I think, like David mentioned, trying to make sure this is a holistic approach, not just about early care and education, has been something that we've had a focus on. A little bit about our most recent plan on the next slide and how we developed that. We also used some design thinking and tried to use non-traditional methods to really center the voices of the people that we were seeking to serve. So there are less than 1 million people in Delaware. We had over 1,000 involved in the development of this plan, which we are very proud of because we went to where people were. We had pop-up meetings on playgrounds. We went to state service centers. So, David mentioned hearing directly from families that were served, creating those kind of use case studies of families who gave up on state services because of how complicated it was. It was very powerful to bring those, to our design planning process. So interesting to see the similar approaches that were taken here. We went to a lot of state meetings, we did text surveys, those kinds of things. And I think that really rounded out a perspective maybe that, especially folks that work maybe in one part of one state agency, didn't really have the full picture. And all of us really got to hear the challenges, cross-sector challenges. So this methodology led us to bring together on the next slide kind of what were our guiding principles. And again, trying to look at this, not just in early care and education, but that we were going to center equity, be about multi-generational approaches, take a whole child approach, and be cohesive no matter what the setting. So, whether this was home visiting or, maternal care, or whether this was pre-K, we had the same principles that we were seeking to apply across all of our recommendations. And on the next slide, you can see our recommendations were in this framework. I'll just mention, we tried to use very intentional language here. So partnership with professionals, that is part of our intention to acknowledge and value those doing the work, and also not limit us to sort of one sector approach. Navigate a simple system is really, trying to take the view of how are we helping families do that. So rather than kind of jargon or government speak, this is about, coming from the place of who we were trying to serve. So just some intentional. These 4 areas have guided our work to implement and sort of track the plan. So I think we have about 40 recommendations across these 4 areas. Every year we do kind of a stock take of which ones have we made progress on, where do we need to make more progress. And each of these is a committee that is chaired and convenes around individual areas that then get raised up to our group. So I see a question, and I'm happy to take it now or later, but how complicated the free services application gets. Yes, we did address families by, trying to go to places where people were seeking those services, so state service centers. We went to families that were in childcare. We went to families that were seeking childcare. We have sort of hyper local groups called readiness teams, early learning teams, of families who told us, why or why not they were engaged in formal care. So we use lots of different strategies. We've used Head Start policy councils. We've used lots of different parent networks. And we still try to do that. We try to hold our meetings either during nap time so the providers and parents can participate, or in the evenings, and try to rotate that, and really not just have the speakers be officials from state government, but try to identify folks from the field, and we'll do that through panels on specific topics or those kinds of things to really elevate, what does this look like day to day? So happy to talk about that more too in the discussion. I think the next slide is really just showing the language that where we've codified that this council exists. The membership is also codified, but I don't know if that's listed here, but really that our charge is about improving the sector and implementing the strategic plan, and that our staff is going to come from state agencies, so that, again, this cross administration. We're not depending on any specific leader or individual, that to try to get that shared ownership that David and Kelly also talked about. I think I just have a few lessons on the next slide. We've talked about how these strategic plans really keep systems thinking in the forefront, and I think that's the benefit of bringing together our cross-agency conversations. I talked about the consistent vision from administration to administration, and like Kelly mentioned, when funding becomes available, then your applications can be aligned, with your current plan. We've been very opportunistic. So when there's, one-time funding from Head Start or PDG, we've leveraged that to do needs assessments and plans. And then really kind of how do we make sure it doesn't just sit on a shelf? We talked about engaging stakeholders. The council is a place where transparency is created for people in the field to come together and speak up and ask questions and say, how are we making progress on, for example, that bill that we passed on lead screening last year? 2 state agencies tried to really center the voices of those served. I mentioned that. We also have benefited from policymakers at the state level who are parents of young children themselves, who are educators, who are small business advocates. And we've really tried to engage them to say, wouldn't you like to help us move this piece of this plan forward in the General Assembly? So we've invited them to come and speak about those things. We've tried to capitalize on policy milestones. So when the state writes a new CCDF plan, we, make sure that we're involved and that that's a cross-agency effort that reflects what's in our plan. And we do crosswalks of our plan with the CCDF plan, that kind of thing. One thing that is key, especially if this is not led by kind of, one agency leader, is finding the right staffing and consulting teams to kind of make sure these things are moving forward. We've been able to garner some philanthropic resources to kind of either loan people or loan project management and capacity. Even for this plan, we worked on some public-private resources to get it designed and translated. I know philanthropy in other states have funded fellows as a way to kind of grow the government leadership sector in early childhood. So most states have some kind of local philanthropy that is involved and that is interested in systems thinking. And I would encourage you to think about those public-private partnerships. And then I mentioned their annual tracking. We try to look every year at kind of what did we move forward? What did we not anticipate? What do we want to prioritize, for the next year? And who can we, build shared ownership with to make sure that's done? We have an annual report that's required in code. We tend to use our stock take as, the way to then inform that plan and to bring that to the agency leaders and members of the General Assembly to say, here's where we are and here's where we still need your help. So just echo a lot of what was said by the previous folks about making sure you have these routines in place, making sure you look holistically, center the voices of those served, build the shared ownership. It's been really critical to us to building a movement. This is now a multi-decade, multi-generation movement of folks inside and outside government working on this shared vision. So we believe in it and are happy to answer questions. And I think I'm turning it over to Saritha so that we can have a discussion.
Thank you so much, and thank you to our presenters. It's now time for us to have an open discussion. So if you have any questions or comments that you want to make, you can either put them in the chat, or you can also get off mute, click your mute button, and ask your question or make your comment. And if we don't have any right away, I do have one that someone sent me. Well, I'll start off with the one that was sent to me. How does your state balance strategic planning and implementation? And why are both important? And we'll start backwards for this one. So we'll start off where we ended.
Yeah, I mean, I would say that, we have a regular cadence now to this sort of 5-year planning. And so, we're trying to stick with the plan that we had and modify as needed, but we're not constantly in a mode of strategic planning. We can modify, we can be opportunistic, we can add things. And I think that's the benefit of these kind of implementation stock takes, of saying every year or more often, how are we doing? Where are we making progress? Where did we not anticipate? There's real value in that kind of stepping back and reflecting and saying, oh, look, for one example in Delaware, we put paid family and medical leave in our plan thinking, okay, well, maybe we'll have a chance, or maybe the feds will pass something. And within the first year of our plan, we saw progress on that. So, it's also being able to be flexible in between plans. And that's one of the ways to balance this kind of planning and implementation. I think, both are important, because to step back and say, where do we want to be in 5 years or 3 years or whatever your timeline cycle is, it forces a different kind of conversation for people to have, and not just the kind of what Kelly mentioned, well, we've kind of always done, or maybe we can make incremental change, but no, really, where do we want to be? I don't think we would have put paid family medical leave in a plan that was, a 2-year plan. So it sets people's sights at a different level of vision. That's what I would add.
Kelly, anything to add to that?
Yes, I do. Can you hear me okay? Great. Sorry about that. I could not find my mute. I tried to expand my screen and it messed with me. So, what I would say about that is that it really comes down to intentionality. How we work together, how we decide what coordination and partnership looks like. And I'm saying this from the perspective of the lens and the focus that we've really taken in this new iteration of this, which is drawing on a solid understanding of what it means to undo racism and exclusion in our work. And so the intentionality has to begin with that before we embark on paving the new path. Because if we're not paying attention to those behaviors, and a really good resource for that is one I'm happy to share through the PDG B5 network by Tim O'Hoon and other people around white supremacy behaviors and antidotes. It's something that we draw on often to help keep us in check. And I'll give an example of one of those: a sense of urgency or one right answer. Those are often dominant culture behaviors and ways of working. And while there is urgency and at times has to be attended to in certain ways, there's a balance in that. And so when you ask about balance, that's what I think we're striving for. And I think for any of us who want to undo and rethink and reshape how we do this work, that intentionality and staying grounded in that way together, with those tools. And I would just say, always sort of holding relationships and giving grace at the center of that, knowing we have to stay awake to it and continue to do learning and unlearning and repair as we build it.
I think we have some more questions coming in. David, do you have anything else to add to that, or do you want us to just move to the next question?
I just want to add one quick piece, though, on I think one of the challenges in the implementation of cross-sector work is, while I think there's a sort of a deep commitment to it, it actually requires staffing and none, and in general, none of the sort of partners, sort of just even thinking at the agency levels, none of the partners are really staffed for cross-sector work. And so I think that's one of the places where we're just starting the conversation of how do we also think about shared resources, not just for the work within the plan, but sort of around the plan. And I think that's just a work in progress for us.
Thank you so much, David. And we have a few other questions, and I'm going to start with the first one, and anyone can respond to this one. We have about probably 2 or 3 questions that came in. Another question came in. I apologize. I have to move back up. So this one is, has your state collaborated and or researched the work of other states? So basically, to what extent have you looked at what other states have done and used it and leveraged it within your work?
I'm happy to start with that. I would just say that over the years, we have participated in the BUILD initiative, and I think that was really central for us and has been in helping us continue to stay connected to other states, always keeping our own in context and in focus in that way. But I'll give Oregon, just to the south of us, there's a lot that we do that's in parallel, and for good reason. And I think that we've leaned into each other at different times. I know as Raise Up Oregon was happening, we were watching with so much excitement and anticipation and a little bit of envy because they were a little bit ahead of us in that. Not that anybody's in a race here, but would just say absolutely. And that just a nod to the BUILD initiative and their continued work to help all of us stay focused on what are the component parts of early childhood systems and how are we thinking about pulling all this together? What are the important components? So I'll just leave it there and turn to my colleagues.
I mean, we've absolutely over the years, looked to several of you on this call in terms of governance specifically, as well as other areas around, everything from subsidy policy to home visiting. I mean, we're constantly looking around, and I think part of the benefit of using a design thinking process is just that you're even looking at, what are other sectors doing? So, often because of the birth to 8 framework, we're even looking at, what are, pre-K 12 systems doing that, we should apply. So absolutely always trying to learn, and then we call it Delawareize, but keeping our state, in context, taking the best of what we can learn from other places.
Also share the gratitude to the BUILD initiative. I think I mentioned that and how integral they were to our process. But I think in addition to BUILD, I have to say our federal partners, thinking about our Region 10 Federal Office of Child Care, have actually been really great. When we've had some questions on what are other states doing, I'll just use the example of alternative rate methodology of connecting us to other states. So I also do appreciate that role the federal partners have also played.
Thank you so much. So we also have another question here on governance, trying to understand where your early childhood program sits, as well as and if you have combined health and human service agencies, which just came up in Madeline's comments. So.
We do not. We have an associate secretary for early learning within our Department of Education, where child care and quality, licensing and quality sit. We have subsidy and public health still in health and social services. And then we have some behavioral health over in what's called our kids department. So we have not yet seen that consolidation of governance, but are working towards it. And certainly that's a place where we're learning from those of you in Oregon and Washington.
And I mentioned this a little bit in my presentation, something that had been really critical for us in the early part of this 21st century is having, a governor and a legislature really backed by several years prior to that, with partners around our Early Childhood Comprehensive Systems grant and the creation of that initial framework, BUILD, our early participation in BUILD, and so many elements coming together to create excitement around it. And we created the first cabinet level agency, Department of Early Learning, which combined 3 parts of different agencies into one. It essentially, it would take me a while to talk about all the pieces that came together to form that. Happy to do that. And if anyone has any questions at any other time. So we survived as a Department of Early Learning from 2006 when it was created until 2018. And when we got to 2018, our state had completed a report called the Blue Ribbon Commission for Children and Families, and it recommended a very strong focus on prevention for our state, which meant they really wanted, the legislature and governor really wanted to draw on the strength of that early learning department and what we had accomplished in just over our first decade. And we created a 3-part agency, now the Department of Children, Youth, and Families, which was launched in 2018. So we're coming on our 4th birthday on July 1st, that combined our whole Department of Early Learning, our Child Protective Services or Child Welfare, part of our Department of Social and Health Services, and our Juvenile Rehabilitation part of our Social and Health Services Department. So 3 big pieces came together, and we went from being a very baby agency at Department of Early Learning of about 250 staff, and in 2018 became a part of an agency of over 4,000 staff, and now the 4th largest state agency focused on prevention. So it has been a journey for us.
And I think I mentioned in my opening, the early learning division, is actually we're right in the Independent Department of Early Learning and Care. Currently, our child care assistance program is in the Oregon Department of Human Services, and that will also transfer over to the Department of Early Learning and Care. And that's also creating some really interesting conversations on, as we do that transition, how do we stay connected and integrated with the eligibility system that's been created for all the human services programs, so that when families are accessing SNAP or other programs at Human Services, they have that same access they do now to child care assistance.
So Rita, let me ask a question. This is Rich Gonzalez. I wanted to ask thank all the presenters, but ask them all a question. All of you seem to be states that have been working on this for quite a while, and yet you talked about the challenges over time. You still don't have it perfect or anything. What if I'm a state? What if I'm representing a state and I'm either new to the state or my state really hasn't worked on this as much as you have? How do I get started? What do I begin to do? Do you have any advice for what, if I'm a state who's only been doing this for 1 year or 2 years or 3 years, what should I be thinking about as I continue to try to work on this area?
That's a great question, Richard. And hello, it's really nice to see you. And thank you for all your and your team's support of us through this process. The first thing I would say, and I said this in my presentation, and that is just always remember that your state and community context is central. So while other states are out doing things and we're all on a continuum of progress of our own, what's happening in your state is what matters most. And I would just say that know that we're all here as partners for you. I don't know how any of us would have done this if it weren't for organizations like the Build Initiative and others who have continued to pull us together around these different parts of our work. But when it comes to planning and really understanding your landscape and thinking about what it is your state needs, given so many factors, lean in to states potentially like yours in terms of demographics, size, other things. I mean, Build is so good at helping us all think about that. That's a good starting place. But I would just say, know that we're all here for you and never be afraid to reach out.
And I would concur on the importance of contact. So, it really feels like the first part is taking some stock of what are some of the strengths, organizational governance that you have in place that you can leverage to start this work, since it's hard work.
I would say look for an opportunity, a policy milestone, a funding milestone, and create routines. What are the ways you're gonna, track this, monitor this, bring people together? Just those systems of, shared work, shared accountability are so important.
Thank you so much. And we're gonna wrap this up. If we can go back to the slides. So the final takeaways from today's webinar, 4 big categories are around engagement and collaboration. So the importance of engaging your community partners, cross agencies, other partners in planning, design, and implementation. So in every phase. The importance of equity. So strategic planning creates an opportunity to advance equity by developing and acting on a shared vision. And equity as a behavior, remember, it's not just talking, it's walking, and it being present in everything that you're doing. The importance also of thinking about power shifting and co-creation. Next slide, please. Third, action. So the strategic plan is not just a shelf sitter. It has to be put into action. You do this by aligning policy and funding decisions, tracking progress, and it's ongoing, continuous. It's a learning process. And finally, to conclude, strategic planning is core and foundational to systems building work. I'd like to thank our presenters and all those that attended the webinar today. Please take a moment to complete the evaluation when you receive it, and we appreciate your attendance again. Have a great day.